About 1 in 8 women will develop breast cancer in their lifetime. For most of these women, surgery will be a part of their treatment plan. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about recent advances in breast surgery for patients with cancer. With me today is Dr. Dawn Jones. She's a breast surgeon with St. Luke's Cancer Institute. Thank you so much for joining us.
Thank you for having me.
So first of all, Dr. Jones, after a breast cancer diagnosis, what are the next steps?
Typically, the next step would be for the patient to see the surgeon. We typically serve as the primary care physician in terms of getting the patient to the other specialists for treatment and scheduling surgery and that type of thing.
And what can patients expect in that consultation?
That consultation typically for me takes about an hour. I have a breast cancer worksheet is what I call it that I go through with the patient. It's 2 pages. First page is what I call Breast Cancer 101. It kind of describes the basic science of breast cancer to them. Most people are misinformed and think that breast cancer is one entity. It really isn't. There are multiple kinds and they're treated in different ways. Then I go through the breast cancer options in terms of treatment. And then we wrap it up with discussions about genetic testing and things of that nature.
Okay. So what are the different types of surgery that someone may undergo for breast cancer?
There are really 2 main avenues. One is a mastectomy. Everyone kind of understands what a mastectomy is. That's when we remove the entire breast. The other is something called a lumpectomy or a partial mastectomy, where we remove just the cancer portion.
Now, over the years, breast surgery has really come a long way. What's changed?
At this point, really less is more in terms of surgery. We've gone from doing a mastectomy on the majority of patients to doing a lumpectomy on a large majority of the patients at this point. So patients have options in terms of their surgical treatment. We also do lymph node surgery where we remove lymph nodes to kind of assess how far advanced the cancer is. And we used to take quite a few lymph nodes. Now we take 1, maybe 2 or 3.
Oh, great. Now, how does today's technology help surgeons find a cancer and aid with removal?
Well, in tumors that are not palpable, that I can't see or feel, I need to have a way to get there in the operating room. I personally use ultrasound localization, where I use the ultrasound machine to see the clip that's placed at the time of their biopsy. A lot of surgeons use what's called a localizer, which is a special kind of clip that's placed by the breast radiologist that they then kind of wave a wand over the breast to be able to detect exactly where that is.
Now, St. Luke's also has dedicated nurse navigators. How do they help patients along the way?
The nurse navigators typically sit in on the initial consultation when I'm talking about their newly diagnosed breast cancer. They help in terms of finding resources for the patient, special needs the patient may have if they travel a long ways, if they have other things that are going on in their social life, their family life. But most importantly, they help get the patient through, navigate them through the landscape of the other specialists, because all of us work together as a team in terms of treating the patient.
Now, what's your final message today for people who are watching?
My final message today would be, it's October, Breast Cancer Awareness Month. Get your mammogram. It may save your life.
Okay, great. Well, thank you so much for being here to join us today.
Thank you.
To learn more or to schedule a 3D mammogram at one of St. Luke's breast centers, visit stlukeskc.org/mammogram. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.